Now to an ABC 15 special report in a family's fight to save their sick child.
The boy diagnosed with a very rare and deadly disease.
There's roughly 100 kids in the United States with this disease and approximately 500 in the world.
Little Woodrow Miller is one of those kids battling Niemann-Pick disease. The medication that some say could help Woodrow live longer is out there. But the pharmaceutical company behind this drug is no longer making it available to all patients, saying it's too risky and hasn't shown proven results.
But as ABC 15's Sonu Wasu explains, it's also the last hope many of these parents feel they have to prolong their children's lives.
Born with bright blue eyes and an even brighter smile, the pint-sized Arizona cowboy now has a rough road ahead of him.
Our daily life right now is consumed with doctor's appointments, physical therapy, speech therapy, occupational therapy.
Woodrow Miller was diagnosed with a very rare and fatal disease just 3 months after birth, Niemann-Pick Type-C.
Niemann-Pick Type-C is a ultra-rare neurodegenerative disease and is 100% fatal 100% of the time.
Also known as childhood Alzheimer's. What this means is Woodrow's ability to walk, talk, and swallow will eventually stop.
You know, you drive by a park, you see kids running, playing with their dads, and I don't know if I'll ever have that. I don't know if Woodrow will ever walk.
Without medication, Denise and Rickey Miller tell me Woodrow might live for just 1 more year.
And within that year, he will lose every skill, every ability he has, and go into a vegetative state until he dies.
It is a heartbreaking disease with no cure, but until now, there had been hope. In the form of an experimental drug called Adra-Betadex that was transforming the lives of children who received it, allowing them to do things their parents never thought possible. That hope ended when the pharmaceutical company behind this drug, Mallinckrodt, decided to pull the plug on production, citing clinical trials that did not show promising results. In a statement just emailed to me, a Mallinckrodt spokesman says they acknowledge the disappointment that patients and families are feeling as a result of their decision to discontinue the development of Adra-Betadex, saying their clinical trials did not go far enough. While they are aware some families have seen benefits of this drug in their children, after exhaustive clinical data, there's no clinical evidence that Adra-Betadex changes or improves disease progression across the group of patients studied. Until October 2021, the company will allow existing eligible patients already receiving treatment access to the drug. Woodrow Miller is not one of them.
It's the most hopeless feeling knowing that there is a medication literally sitting on the shelves across the country that 40 other children are getting access to, and that Woodrow is being denied access. All of his neuro testing.
Denise Miller shows us Woodrow's medical binder filled with every MRI, every lab test. She shows us the emails she has written begging those in charge to allow her son access to the drug. The fight to prolong her son's life has consumed her life.
Are you willing to sign whatever they need you to sign to get your son access to this medication?
Of course, I will do whatever it takes.
Especially with time running out. In the last 2 months, the Millers tell us, they're already starting to see their little boy getting weaker.
Some days are better than others, you know. Some days he's happy-go-lucky, and other days he goes into staring spells and he won't respond to his name.
Day by day, fading away.
It's very unethical that 40 other kids are getting this medication, but yet we can't access it.
As families like the Millers fight for access to Adra-Betadex, they are hopeful another pharmaceutical company can pick up the development of this drug. Despite the clinical trial results, those who have used Adra-Betadex argue their children are proof the drugs work. But for Woodrow,
He needs it now. If we have to wait, it will be too late for Woodrow.
the Millers worry time could be running out. In Phoenix, Sonu Wasu, ABC 15, Arizona.
Woodrow's family and many others now pleading with lawmakers and the FDA to step in here to allow their children access to this medication at their own risk. They know it's experimental. We will let you know the FDA's response to all this as soon as we hear back from them.